and experience with both her patients and peers alike. Her areas of expertise is orthopedics. Among others, she's a certified orthopedic specialist focusing on back and neck pain, knee pain and arthritis, shoulders dysfunction, as well as post-surgery rehab, among others. Along with her technical skills, Alka practices with the patient-first approach and is a huge proponent of prevention over cure with the appropriate posture, support adjustments, and techniques as part of her patient's lifestyle. So again, thank you so much. I'm just curious, Alka, the last 35 years, how many patients are returning patients to you?
First of all, I want to thank Diva for giving me this opportunity. And as an answer to your question, I would say anywhere from 30 to 40% of patients are my return patients. Some of my 90 years old will tell you they have seen my kids grow up, because once in a while my kids will come to the clinic. And they remember even my daughter jumping on the trampoline. So that's how long some of my patients I'm known for.
That's fabulous. That means that people trust you and want to be treated by you. So I think your approach of patient first is working for you. So thank you again, and I'll let you start.
There's some other screen came on my computer. Let me see. Can you guys still see me?
Yes.
Okay. Okay. All right. Thank you, ladies, for joining on a Sunday morning today. And luckily, we had such a nice, bright, sunny day. It was so nice to see the sun in last couple of days. We haven't seen sun in like more than a month. So we all know when we didn't see the sun, how less motivated we were. We didn't want to move. We had no energy. We had no motivation to even do anything. And it just was like, you just wanted to bundle up and sit on a couch. As a physical therapist, what I see when the patients come to me, because of all the inactivity that has been going on, especially during winter months, especially with my seniors, when they come in, they end up hurting themselves quite a bit. So they start trying to shovel the snow. They start trying to clean their sidewalk, and they come back with a back pain. I'll have patients starting like gardening in spring months. They haven't moved in a whole 3 to 4 months. And when they do it, then they end up with a back pain, neck pain, knee pain, and you name it all. So I feel prevention is better than cure. It's better to take care of our body even during the winter months. I do understand with the winter months, our activity level changes. We don't want to move as much. We need to honor our body, but maybe change how we approach our physical activity, how we treat our body. In summer months, we are super active. We are going out, we are walking, biking, swimming, hiking. Even in fall, we do that. But in winter months, we stop doing it completely. What we can do is maybe change the activity a little bit to cater to the way our body is behaving during winter months, but not stop it all not stop the activity completely. So if you look at the data shows that around 34.5% people in Michigan are obese. And close to 24% people within Michigan, they do not do any physical activity which is not part of their job. And these data are a couple of months older. If taking care of our body small amount, making it part of our routine, part of our day-to-day activities, if we can take a little time, we can prevent injuries, we can prevent our metabolic rate dropping down. We can even elevate our mood. The research shows that when you exercise, the endorphins released in your body, which makes you feel happy. So what I'm going to do today, I will try to take you through the whole, like a stretching for the whole body. But what I'm going to do, I'm going to break it down into different levels. So we are going to do some stretches for the whole body while we are laying down. I'm going to show some stretches while we are sitting up, and then some stretches for the whole body while we are standing. And I have my friend over here, Cindy. Cindy, would you mind joining us? And she will, this is Cindy. She is, she's a certified trainer, personal trainer, and she beats my butt when I go to the gym. And she thankfully and agreed to be my model today. So what I'm going to do, I'm going to start with from the top of her head all the way down to her feet. So we're going to start with some stretching exercise laying down, and we're going to start from the neck area. We're going to go to our chest area, to our legs laying down. Then I'm going to demonstrate stretching exercise in a sitting position, and then we're going to show some stuff in standing position. So Cindy, if you don't mind, why don't you go ahead and lay down? And please let me know if you guys cannot see very well. I'm going to try to move the computer a little bit. Okay. So what we are going to do today, so we're going to start with the neck area. So when you're laying down in the morning, before even getting up, you can start with your neck. Start by gently stretching the back of your neck. Most of us, with our phones, with our lifestyle, with working on the computers all the time, we are always with our head pointing forward. How many times we all are doing this? I have caught myself doing this multiple times during the day. So before we get up, just laying down with a pillow underneath the head, gently tuck your chin in, where you are gently feeling the stretch behind the head. And all you have to do is hold it for 10 seconds and then release the chin. I normally would recommend do like a sets of 10, easier to remember. Some stretches, 10 seconds are good enough, but when you're working with the bigger muscles, as we kind of come through it, you do want to hold the stretches for more than a minute, closer to 2 minutes, which makes a better change in the tissue length, in the length of the muscle. So, and there is another way to do this particular stretch. Give me a second, I need to grab a towel. So you can take a hand towel, double it up, and just roll it in a cylinder like that. And all you need to do is put it underneath your neck and gently tip your chin down and feel the stretch. Can everybody see the stretch?
Yes.
So this is what you start from the neck area. You can do this particular stretch in sitting position too, which I will go over when we start demonstrating the exercise in a sitting position. There is one thing before we proceed further, I will say, I do not believe in no pain, no gain. A lot of my patients will come in and they say, oh, we have to feel the pain to feel better. But pain is body's way of telling you that you are hurting me. Everybody has to be in tune with the body. They have to see which movement, activity, position is painful. As a physical therapist, certain things we will say, okay, this is all right, but you need to consult a professional for it. if something is painful, the rule of thumb is you're possibly not doing it right, or you're doing something to hurt it, or there is an injury already in the area that needs to be taken care of. So the next exercise is coming into the chest area. Just want to put that. There we go. And you can interlock your fingers like this and just gently put it behind the head. Cindy is pretty flexible, but sometimes if you try it yourself, you'll notice that you'll feel a tremendous amount of stretch in the pectoral area, front part of the chest. And you can feel the stretch. What sometimes I tell my patients is like Cindy being so flexible, I will tell them to move the pillow long way and bend the knees to take the stress off the low back area. And you can already feel the stretch in the pectoral area. Did you notice the increased stretch? So this is one way of stretching your front part of the chest. The other way you do it is you can let go. And sometimes I've noticed people have a hard time holding the hands behind the head, especially my seniors. Sometimes they have some shoulder injury happening, they're in pain, they maybe have arthritis, they maybe have any rotator cuff tear. If that's the scenario, all you do is keep your hands like this without interlocking and just let it drop. And you still hold the stretch 30 seconds to a minute. If you're doing a stretch for 30 seconds to a minute, you can do maybe 3 stretches. I personally definitely prefer longer stretches than doing like a 5 to 10 second stretch. Because you want the stretch to go beneath the muscle, beneath the skin. We want to feel the stretch in the fascia. We need to feel the stretch in the tendons and the ligaments, but watching that it's not painful.
Alka, so this is just the stretches while you're in bed, right? Correct?
Yeah, so like you can make it, that's what I'm trying to say. You don't have to specifically take out 20 to 30 minutes to do it. Mm-hmm. So the reason is, whichever position you are in, you can do it. I'll show you some stretches that you can do for the neck in a sitting position. And sometimes, especially we all are leading a busy life, we can even do it like at a red light while we are waiting for somebody. We can do a lot of stuff incorporated within our day-to-day life where we don't have to specifically take out 30 to 40 minutes, 20 to 30 minutes, because you hear it, oh, I don't have time to do it. I'm busy with my young kids. I'm busy with my work. I'm busy with taking care of the house. These are stuff that you can just take maybe short duration and you can still do it. The next one is stretching your glute muscles. Since you're already in the bed, keep your knees bent. Gently pull the knee towards you and you hold it right behind the thigh. A lot of time, like Cindy was trying to do, is trying to hold it on top of the knee. But what ends up happening? Somebody who has an arthritis in the knee, they are in pain. They cannot bend it this much. You just hold it behind the thigh and gently pull, and you're going to feel the stretch in the glute area. Same thing, hold it for 20 to 30 seconds. Gently bring it down. And then you go ahead and stretch the other leg. Make sure you balance it out. You need to stretch it on both sides. This is the most easiest version of doing this stretch. If you're a little bit more flexible, you don't feel it as much. Another version, you keep your other leg completely straight. And then you bend your knee. This way you stretch the hip flexors, which are the muscles right in front of our hips. Quite a few of us have tight hip flexors. And when you have a tight hip flexors, you'll see people arching the back. They go like this because the muscles are tight, which puts a lot of stress in the low back area. Same thing, hold it for 30 seconds to a minute. Gently lower the leg down and go ahead and bend the other leg. With this particular stretch, the main thing you have to watch is that you are not arching your back. You can see that you are not lifting your back up. I should not be able to slide my hand underneath the back. You don't have to push your stomach in. You just have to let it be. You don't want to overdo your, like you don't want to pull your tummy in. You just have to keep it relaxed. You just have to make sure you do not arch your back when you pull this leg up. Most of the time when the hip muscles are tight and you're trying to push this knee down, you will arch your low back. The other stretch is opening the piriformis area, the back muscles over here, and stretching the inside muscles of your hip. In the same position like this, you can cross your leg over. You can use the hand on the side which needs you bending it and gently push it away. You feel the stretch in the hip area. This particular stretch, because this muscle is mostly very tight, I always recommend at least hold it for 2 minutes. Most of my patients with back pain, I will give them this stretch. But one thing that I will tell, that if you are having any nerve pain radiating down the leg when you're doing this stretch, please do not do it. Please back off. You do not want to increase the pain radiating down the leg. It does work very well in patients with back pain. But let's say you have a disc herniation where the nerve is getting irritated, where the pain is radiating down the leg. And if this particular stretch is increasing the symptoms, please do not do it. Please consult your professional, whoever you're working with. Always balance it out. Make sure when you're doing the stretch, and you can see a little bit that Cindy kind of rolled over this way. I don't know if it's very visible. You have to make sure that your hips are level. They are equal on both sides. So this is comparatively an easier version of doing this stretch. You can make it a little bit harder or go deeper into the stretch. Leave the legs in this position. You take your hands and go behind your thigh and gently pull it towards you. And you can feel a little bit more deeper stretch. Sometimes I've noticed with some of my patients, it can be a lot of different factors. It can be a lot of stiffness. It can be they're having maybe a belly. They're not able to pull it. Then what you do, take a towel or a sheet. You just put it behind your thigh, you fold the towel and gently pull it towards you. To keep the stretch a little bit more deeper. I'm going to show you another version of this particular stretch. Second. Some of the people in their home might have balls like this. We call them Swiss ball. They're easily available. If you want and you don't want to pull it with a towel, you can brush the leg on it and gently pull it towards you, and you will feel the stretch. Same thing with this particular muscle, because we do not stretch this muscle a lot. There are very, very small muscles that we are trying to stretch along with a bigger group of muscles. This particular exercise, I will highly recommend to hold for 2 minutes. If you guys are at home, you guys can try laying down and trying the stretch while we are doing it. and see how you feel. I'm gonna take a pause. While you are in this position, you can always stretch your hamstring muscle. Same thing, you pull the leg towards you. And when you are doing this, holding the thigh with your hand, you gently pull your leg up straight. And you are getting your hamstring muscle stretched. Most men have very tight hamstrings. As a woman too, we have tight hamstrings because we are sitting all the time. We are keeping this particular muscle in a very short position throughout our day. We do need to stretch it. You can do it in this position. If you feel you have a hard time doing it, you can always take a towel or a strap and pull it. If you want to go deeper into the stretch, you can always bring this leg all the way down and feel a little bit more stretch.
Alka, do you keep your foot flexed or pointed to the top when you're flexing for the hamstrings? And I know there's different variations.
There is a different variations to it. When you keep it flexed, you do feel stretch your hamstring and the calf muscles. But if you are having a sciatica where the pain is radiating down the leg, then you don't pull it. Because when you pull the foot like this, it put a big stretch on the nervous system. And if you're already having pain radiating down the leg, it can irritate it. Does that answer the question, Savita?
Yes, thank you.
While you're in this position, while you're on the bed, we need to stretch our quadriceps muscles too. Tight quadriceps and hamstring are one of the precursors of causing knee pain. Most of the time, including me, when I do it, we'll stretch our hamstring, we'll stretch our calf muscles, easier to do. We forget to stretch our quadriceps muscles as much. So what you do, you roll in bed, lay on your stomach. I always recommend people to use a pillow and gently slide it underneath the belly button. You do not want to exaggerate the curvature of your spine. You want it flat. In this particular position, you gently bend your knee and feel the stretch. Cindy is pretty flexible. You can see that you can either hold a towel, reach back, and pull it. There is, let me bring another version to it. We call it gate belt, a transfer belt. You can even have a dog leash in the house and you can use it. You can gently just put it around your ankle, like a lower leg. And you can just pull it with your hand, especially for people who have a hard time reaching behind with their hands to reach it. This really works the muscle. When you're stretching this muscle, see how her leg slightly pulled out more? This is because of the tight abductors, the muscles on the outside of the hip. You have to make sure that you keep your knee in slightly. Same thing, you release.
Okay, is there a certain type of pillow that we need to use? Because there's so many different ones, flat, fluffy. Is there something you recommend or just any kind of pillow?
Any kind of pillow is fine. As long as sometimes like for her, one pillow is good enough. I've had patients where I have to use 2 or 3 pillows. It all depends how your spine is. You have to make sure when you are in this position that you don't feel your back is arching. Some people who have very tight hip flexors, you need 2 or 3 pillows. Some people who don't have tight hip flexors, 1 pillow is plenty. And the same way you put the strap on the other side and you feel the stretch in front of the thigh. Does anybody has any questions while we are in this laying down position?
Alka,
Yes.
I had a question. So I know you were showing the stretching positions lying down. So is there a benefit doing lying down versus the standing?
The I'm trying to do the stretch. No, there is no difference. If your body is more supported, like your hamstring stretch that you do, laying down, your back is a lot more supported, so there's a less chance of you hurting it. I'm trying to show the stretches that you can stretch it any position you are in. You don't have to specifically take our time, say, oh, I'm going to do it in lying position, or I have to lay down now because I'm busy, I don't have time. All I'm trying to show is that you can do it in different positions. You can incorporate into your day-to-day life. Even before you get out of bed, you can stretch your muscles.
I think that's a very key thing that you're saying, that a lot of people say they don't have time. You know, time is the essence. So I think that showing that even before you even get out of bed, you can stretch for, 10 to 15 minutes before you even get out of the bed will help, for you to be stable and for you to go on with your day. So that's really a key, that you can do these stretches anywhere at any time.
Exactly. There is one more stretch I want to show in lying position, and that's for the spine. Can you do it in the back? And that's to stretch the side muscles of your back. You keep your knees bent. Most of the time, what I see people is they just drop the knees like this, which is put a lot of torsion on the spine. What I always recommend, slide your hips, lift your hips or slide it to the left, and then drop your knees. You can always bring your arms out, and you can turn your head to the opposite side. When you slide your hips, you keep your spine neutral. You are preventing a lot of torsion between your spine and the disc area. You have to be careful with the spine stretches first thing in the morning, because overnight our disc absorbs a lot of water. And when we doing a lot of torsions, first thing in the morning, it can cause stresses on our nervous system, on the spinal nerves. So you have to be careful. So that's why if you are going to do this particular stretch first thing in the morning, make sure you slide your hips before you start rotating your knees to the other side. Same thing. If you're going to do on the opposite side, slide your hips and gently drop your knees and then turn your head. And this stretches the side muscles, quadratus lumborum, your gluteus, maximus, all the muscles in the back. What I'm going to do now, I'm going to show you stretches that you can do while you're sitting, especially when you are working on the computer. Quite a few people, we all work on the computer. We are on the phones all the time. So go ahead and bring your legs down. So what you can do, the same thing what you did, the chin tucks that we did laying down in the sitting position, you just gently pull your chin back. And you're going to feel the same stretch in the back of the neck. Quite a few of us, and this is where we are. I have to correct myself most of the time. I will round my shoulders like this and my head will be like this. So you need to pull your shoulder blade gently back and just gently tuck your chin in and feel the stretch, the back of your head of the head. A lot of these muscles, they're very, very small muscles at the base of our head. A lot of times, especially when we are very stressed out, when we're trying to drive, get somewhere on time, these muscles are tightened up, these muscles tighten up, causing the headaches in this area. This particular stretch, you can easily do it when you are even in the car. Stopped at a red light, you can easily do this stretch. You are on a call, on a phone call, you're on a Zoom call or anything, you can easily just sit up and gently stretch the back of the head. Same thing, because these are really small muscles, 10 to 20 seconds of stretch is plenty for these smaller group of muscles.
Alka, can you show us a little bit about the rotating of the neck? Because I know that that's really also very helpful when you're sitting on the desk.
Yeah, I'm going to show you that because there is this stretch. There is a muscle right here that you need to stretch. And Cindy, do you mind just turning and sitting more like in this position? So what you do, you stretch the back of the head. Now we want to stretch these muscles over here. We call it levator scapular. So you just turn your head maybe 30 to 40 degrees. And in this position, you tuck your chin and you pull your head forward, and you're going to feel a gentle stretch right in the base. Can you feel the stretch over here? Yep. Cindy is right now, I don't know if you can see her feet, but her feet are, I'm just going to drop it down. She's on her tippy toes. So this puts a lot of stress on the spine. To do this stretch, make sure your feet are flat on the ground. Also, most of the time, what I notice, people tend to shrug the shoulder up like this. What I recommend all my clients is pour the chair of whatever you are sitting on and gently, and then turn and you stretch. Let's try it on the other side. You gently just turn your head and you just tip. Sometimes what I notice, people will do this. So keep your chin slightly tucked in and then drop your head. And you're going to feel the stretch right on the side, right at the base of the neck over here. You guys are all on the Zoom call right now. Everybody's sitting. If you want, give it a try and see how it feels for your neck. I will show.
Good.
I'm going to show one more way, one more stretch in this position is you turn your head, you tuck your chin in, you drop your head, and then you try to look towards your opposite armpit. And you will see the change of the stretch a little bit higher up. All of us, we all are like this under stress. Even in winter months, if you see, we are bundled up, we are kind of pulling our shoulders up and trying to round up. No, so you tuck your chin, you bend, and then you turn towards your opposite. So there is a series to it. You tuck your chin in, you drop your head forward, and then turn your head. You get the stretch. Now we want to stretch our upper back area. You want to stretch the front part of your muscles. While you're sitting, you can hold your hands forward, slightly at a 45-degree angle. You don't have to bring it all the way up. Just lower down is good. You tuck your chin, and then you round your spine as if you're trying to stretch your shoulder blades away. Cindy, do you mind just turning so? Okay. Tuck your chin, and then you pull. So you kind of open this part of the spine. You stretch this area out. You have to make sure that you do not shrug your shoulders. Keep your shoulders away from your ears. In the same position, you can reach behind. You interlock your fingers. Before you start doing anything, you squeeze your shoulder blades. And then only then, if you can, pull your hands away where you stretch the front part of your chest. If you're not as flexible and you cannot hold your hands together, you can always just hold opposite elbows. If that doesn't work, you can always use a towel and do the same thing.
I think one point that I wanted to make here is doing these stretches mindfully, meaning that really taking that time to connect with your body and the muscle, because I realize that when you're just sitting there going like this is so much different than when you're really taking that time to go finish. You're taking that time to rotate your shoulders and then reach and then do the other part. I feel like it's a little bit more mindful and can give you a little bit more stretch than just going through the motion.
I agree with you, Savita, because it's not just the stretch, it's to do the stretch safely. Just rushing through the stretch, you will, if you're not careful of pulling your shoulder blades, and if like I'm here and I'm trying to pull this, I will end up hurting front part of my shoulder. But if I pull myself up, squeeze my shoulder back, shoulder blades back, and then pull forward back, you will see a difference. You are stretching the exact muscles. You are not yanking the front of the shoulders. You're not stressing your biceps too much. You're not stretching your rotator cuff. Like you're not straining them. So you need to do it mindfully. You have to take time and listen to your body. There should be no pain. If you are having pain with any of these stretches, there is a chance that either there is an injury that needs to be taken care of or the stretch is not being done the right way. Most of the time, especially with the neck area, what I normally notice when people are trying to stretch, their chin is going to go forward. Either their shoulders go up. So you have to be careful to make sure that you're keeping this area relaxed. Like this. So in this particular position, I have to move. In this position, what you are going to do is you can always stretch your low back area. So you spread your feet out slightly more than your hips. And then you gently lean over, try to touch the ground. And you're going to feel the whole spine stretch. This particular stretch, I will highly recommend do not do within first 30 minutes of waking up. And the reason is your discs have a lot of water when you first wake up in the morning. You do not want any disc bulging. So anything forward bending like this, I would wait for 20-30 minutes before you do it. So you can feel a lot of stretch in this whole spinal area. Kind of really opens up the spine, the low back, especially when you are feeling constant tightness in this area. When you're cooking, you are standing washing dishes, everything is so tight. This really opens up. What I normally tell my patients, I do see a lot of low back patients who have very weak core muscles. If they have a really weak core muscles, I tell them from this position before coming up, take your hands on top of your knees and then gently push your body up. If you have a good strong core, you can come up. But if you have weakness, you feel when you're coming up, you're arching your back too much. The best way is put your hands on top of your knees and then push up. Let's try one more time. So same thing, you just gently go forward, feel the stretch. Your head just drops down and just gently feel the stretch. You don't try to keep your head pulled up because head is pretty heavy. It's normally 10 to 15% of our body weight. It's like a big football on top of our small neck. So you need to be careful and then you put your hands on top and then you gently come up. If you have a ball, big ball like this, like we have in our clinic, some of us do have it at homes too. You can do the same stretch. You put your hands on top of the ball and then gently roll the ball forward. I would recommend you do this only if you feel you have a stronger core where you're not arching your back when you're coming up. And you kind of, when you start coming up, engage your muscles over here. You don't have to suck it in. You just have to engage the muscle just below your belly button. Same thing, you just drop forward, feel a gentle stretch, and then gently come up. If you're not as flexible, you're very tight, you can just come down and just put your forearms on the thighs and just lean forward like this. Or you can just hold just below your knees, ankles, whatever is your flexibility wherever you are starting with.
So, Olga, I know that bends like this because if you have a belly, it's hard to come all the way down. So do you suggest for that the ball for that? Because I know a lot of people that's one of the problematic issues.
Balls are easier. It will help you move more. And
Okay.
you don't have to go that far forward. But the only thing is you have to be careful coming back off the ball. The further the ball away, and then you're trying to pull back, harder it is on your core. So you have to be careful coming up, or you can walk the ball back like the way Cindy did.
Okay.
Okay.
I know some of the question we might have is because some of them.
The other stretch is the figure 4 stretch, or to stretch your piriformis muscle that we did laying down. Same thing in a sitting position. You just cross your leg over, and you have to make sure that you're not slouching. You're sitting up tall. Your feet is flat. Cross your leg and gently push, not on the knee, more in the thigh area. People who have a lot of arthritis in the knee, when you push down on the knee, you can put a lot of stress on the collateral ligaments and the meniscus. So maybe stretch gently on the thigh. The main thing when you're doing this particular stretch is not that you're not leaning on the hip. You're sitting with equal weight on both the hips. So you are sitting balanced. You might not be able to, some people I've noticed they're possibly here. It's okay as long as you feel a gentle stretch. And if this doesn't work for you, you have a stretch that you can do in a lying down position. Sometimes they have arthritis in the hip. A lot of arthritis, this might not be the most comfortable position to do. Sometimes you have, not sometimes, quite a bit, we have a lot of tightness around the hip. It's not the easiest one to do. You do the best, you listen to your body. Make sure if it's painful that you don't do it. And then you consult a professional. That's her. And this is something, you're sitting working on the computer. You're sitting on your dining table. You can easily do this so easy, and you don't even have to take out specific time for this. Sitting for long duration in the car. If you're traveling a longer distance, you can always come out of the car. There's a lot of benches around. If you stop at a rest area or anywhere, you can do this stretch. It stretches this area quite a bit. A lot of times people who have back pains, tightness in the hip, pain in just in this area, this particular stretch helps. But I'm reiterating again, if this stretch is painful, please consult the professional. While you're in this position, you can stretch your hamstring at the same time along with the calf muscles. I'll show different versions of doing it. So what you do is you bring your leg straight, just put your heel down. For this, you'll have to sit a little bit on the edge of the chair. You cannot sit too far back. You pull your toes up. You pull your body up tall. And then you just hinge from the hip. And see how her spine is slightly in a neutral position. She's not overarching. Kind of keep a neutral position. Keep your chin slightly tucked in so your head is not going forward like that. And you will feel a stretch all the way behind the thigh. A lot of times what I notice as a professional is when people are bending over, they round up and they go forward and they feel they're stretching your hamstring. Hamstring is a 2-joint muscle. It attaches in the hip. It attaches below the knee. You have to stretch it on both ends. You cannot stretch on one end and let go of the muscle on the other end. Sometimes patients don't feel very comfortable doing it. So what you do, take a step stool. You can just put one foot on it. Same thing, hinge forward and then lean. And if you pull your toes towards you, you can feel the stretch in the calf area. Same thing in this particular stretch. Make sure there is no pain radiating down the legs. Any questions so far? What I'm going to do, I'm going to show some stretches in a standing position. So we're going to come over here. I'm going to
Alka, just a time check. It's 11:50.
Yeah, but that's what I just checked. So I'll be quick through a couple of the stretches in a standing position, then we can take questions. So many of us have stairs in the house. When you're going up, you can stretch your calf muscle. So you just stand on the last edge of the stairs, hold it, and just drop your heels down. And you are having a stretch in the calf area. Stand for 2 minutes before you go up. It's part of your routine. You have stretched your calf muscles right there. You don't have to take a specific time to do it. If you step down for a second. In the same position, what you can do before you go up the stairs, you can just prop your heel up, put your toes towards you, put your body up tall, and just hinge forward, and you will feel the stretch behind your leg. Make sure you balance it out. If you do the right side, make sure you do the left side also. And I'm going to show you another version of the calf stretch. When you're going up the stairs or standing by the wall, you take 1 foot back, you lunge forward with the front knee, keeping both the heels down, and then you just lean forward. In this, Cindy has good awareness of her body. She's maintaining a good spine. A lot of time I've seen people either rounding up or they're arching too much like this. So keep a neutral spine, keep a neutral spine. And what I mean by neutral spine, if everybody holds their hands like that, they arch and they round up, and then you release and come in the middle. That's your neutral spine. That's your spine curvature. Do you guys have any questions? I know we are a little bit on a crunch of time, so let me know if there's any questions anybody has.
Thank you, Alka. No, these were really great, and I really liked the correct postures. I mean, I teach yoga, and sometimes I even forget when I'm teaching it, to correct people. So this was really helpful to know all of the way to do it. The other thing I just want to, for the audience, that a lot of times people do not do or are active or do physical therapy during the months of January through March. Is that correct? Alka, that
February, yes.
and to not to take care of them so that they can. So these are really great, helpful tips when you're, trying to get the insurance cover these things.
Right.
Yeah, there is a question from Meeta Alka. I just read it. She says, all the lower body stretches shown here, would they be good before and after walking?
Yes. So you do a little bit of, you do your calf stretch and your hamstring before you walk. I know quite a few of us are trying to get ready for marathon. We are doing a longer walks, stretching your hamstring, your calf muscles, and your quadriceps, and your piriformis muscle, the hip muscles. They're very important, very, very important after walking, especially when you're doing a long distance walking. When you're doing an exercise, your muscle shortens up and you need to bring it back to the full length. The shorter the muscle is, the tighter the muscle is, and it's more prone to injury. The more the muscle is in its full length, the muscle is working at the optimal level and it prevents injuries.
Thank you, Alka. So, how many times? So, suppose I walked for an hour and I want to stretch myself. So, should I do all of the stretches or just one or two and just like few minutes and be done, or
If
do
you
they
are
have to be like
working,
15?
especially the hamstring and the quadriceps muscles and the calf muscles, at least 2 minutes on each side of
Okay.
a stretch. If you don't have a lot of time, you can combine your hamstring and the calf stretch together, the one that you can sit up and pull your foot up, 2
Yep.
minutes on each side.
All right. Thank you so much.
Crossing the leg over, stretching it 2 minutes on each side.
Okay.
You can also, I didn't show for the quadriceps, you can always just stand up, hold the wall, bend your knee, and pull it, and you'll feel the stretch in the quadriceps. So you don't really have to lay down to do it. You can do it in standing position too.
All right. Thank you so much.
You're welcome.
Is there anything called as overstretching? Like is there a limitation that how many times in a day you can do, or is it like too much is too bad?
Too much is too bad. Stretch it as I explained. You stretch it where you feel a gentle stretch and you feel the length happening. You don't want to go to the point of pain. You can overstretch and cause pain, yes.
Any questions?
I'm sorry.
I was just asking if there's any other questions. I think that
I just had one quick question, Smita here. You were mentioning that the exercises, the one that were lying down exercises, can be done on the bed. Are there any, like, is there any difference or benefit like lying on the bed and doing, because sometimes a bed can be hard, soft, or whatever, versus lying on the floor with a yoga mat on it? Like, is there a difference between the two, or is there benefit one versus the other, or it doesn't matter?
The laying on the yoga mat is definitely a better way of stretching it. I was just trying to incorporate and show people that you can do it while you are getting up out of the bed. Sometimes people just, when they get out of bed, they forget it, they get on with their lives. So some of the stretches you can do in the bed, as long as the bed is not super soft.
Right. Okay. Sounds good. Thank you.
all right, we're right on time. Alka, thank you so much again. You definitely have given us a lot of things to think about when we're getting out of bed, when we're working on the computer, or even just, walking around, standing to stretch our body, move our body. Tell us where we could get hold of you if we wanted to get more information about the way you stretch, or how can people get hold of you? I know you have your own clinic in Troy, I believe.
Yes, I have 3 locations. I work out of a Troy locations. We have a clinic in Clinton Township and one in St. Clair Shores. I work out of Troy location, which is on the crossing of South Boulevard and Rochester Road. And my clinic's number is 248-828-1100, extension 2. Or you can reach out to me on my cell phone. It is 248-495-2398.
Okay, if anybody needs more information, work out with Alka, walk with Alka. She's training for the marathon herself, so we can learn all of this while we're training as well. all the good forms and all of the things to do that are great for our bodies. So again, thank you so much for everybody who joined. I hope you found this session helpful to your daily routine and you're able to move better and more. So thank you again, Alka. Appreciate it.
Thanks a lot, ladies. If you have any questions, please let me know.
Thanks,
Any-
Alka. Wonderful
Thank you.
presentation.
Great
Thanks,
presentation.
Alka. See you
Bye.
later.
Thank
Bye.
you.
Thank you, Alka. Thank you
Bye.
so much.
Welcome.
Thank you so